So what you're seeing is just higher price options for patients. Maybe the subsidy on the cost of opioids was part of the problem. I can see that, but medical marijuana is filling it. Obviously, as interventional physicians, we want patients to continue to have access to interventions. So, we would rather do targeted procedures and do long-term procedures like spinal cord stim and use those kind of modalities to treat people. We all are trying to walk back the place we were at with opioids and use them in a much more sparing capacity, where the big problem right now is the legacy patients. I would say most of us are not creating any more high-dose opioid situations. We've learned our lesson, and we're trying to walk back the people that were on the high dose, but what do you do with these legacy patients that, they're on a bit above what the government says is, reasonable, but they're not hurting anybody and they're functional and they're using their medication appropriately. A lot of these people are losing access to their meds and scrambling to figure out who's going to treat them, what are their options, and right now it's interventional pain, adjuvant medications that have been around for a long time, and the medical marijuana is playing a role. I also see ketamine playing a role too. So patients getting intravenous strips of ketamine is a reasonable option now to help people manage pain and come off opioids. So there's a few things out there, but a lot of what I mentioned is out of pocket, and people are paying a lot for health insurance to find out that a lot of the things they want to get pain-wise are going to cost them more, than they realized.